Hi, I'm Dr. Jamie Wells, and I'm the Director of Medicine for the American Council on Science and Health. I knew I wanted to be a doctor from a very young age. My grandparents lived with us and we all contributed to their home health care. I also came from a medical family. And my grandfather was a true Renaissance man. He could paint a portrait in one hand and solve a calculus problem in the other simultaneously. He taught me the Pythagorean theorem when I was 4 years old. We did math problems together. I wound up falling into pediatrics, trained at a cystic fibrosis center, which was just a honor and privilege to be a part of. Those patients were incredible human beings, incredible outlook on life, and it just was a wonderful opportunity. And children get you back into why you go into medicine in the first place. There's such a purity and honesty with children and the way that they see the world. So I wound up practicing pediatrics and practicing medicine in Manhattan for 13 years. The exciting thing to me is constant continued learning, delving into topics, really diving in, learning everything you can about them, breaking them down to their core basics to communicate them to everyone else is so utterly exciting. And that team component is something that you often don't get when you practice throughout the day. Even though you encounter a lot of patients, it can be alienating and isolating sometimes. As a practicing physician, those relationships are built over time. So what I love here is you can really suss out ideas, and I think that keeps everybody at the tip of their toes and continuing to learn, grow, evolve, and really inspire them to bring even more to the table. The internet and everything that abounds with the 24-hour news cycle, there is just a wealth of bad information. You could have a Nobel laureate's research standing next to someone who isn't necessarily fully informed, and it's hard for the public to discern what is of value and what isn't. And I think that helping clarify those things is critical to easing suffering and assuaging fears. And so that is something that I really want to pursue in this chapter.